Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
I do want to get, Susie wrote in a question, which I think, we cycle on all the time. What are some questions to ask when looking for a good ABA provider? Thank you, Susie. I think
that's
it's a
great
perfect question.
Susie. It is. That's like an area that Shannon and I are both pretty passionate about. So I'm really glad that you asked. And I'll throw some out, and Shannon, please throw some out as well. I guess I would start with finding out about the credentials of the people providing the services. So, I'm not big into, I don't care about licenses or degrees, but having a BCBA or board certified behavior analyst kind of gives you some level of assurance that the ABA that is taking place is at least of a higher quality. And those are the individuals who are the supervisors, are usually BCBAs. And in terms of therapists or individuals who are actually doing the direct work, you should maybe ask and say, how many of your therapists are RBTs, registered behavior technicians, or BCATs, board certified autism technicians. It's kind of important to make sure that these credentials are somewhere there, only because you have to go through a ton of training to get these credentials. If someone doesn't have the credential, it doesn't mean they're not good. In fact, some of my favorite therapists don't hold these credentials, but they have 10 years of experience. So that's kind of the other side of it, is how much experience do your therapists have? And if you're hiring therapists, how much training do you give them? That's a really, really important question. Take a look at the training that's given to the individuals, and it cannot be all class time, because we learn the best when we're actually doing hands-on practical work, right? So those are some questions: the credentials, the training. And then I think I would ask how much parent training and education is provided, because I think as parents, the more we learn about ABA and what's going on with our child and autism and the treatment program and all of that, the more involved we are, the more we know the data that is being collected is actually good and accurate. And we just give it a different level of quality if we're involved as parents. So I would find out what parent training they provide. And then I think for me, it's really, really important. There are some incredible behavior analysts out there. In fact, I'm just about to interact with one of them because I'm trying to help someone open a series of clinics in Saudi Arabia. And there are some providers of ABA who are fabulous at ABA, but they absolutely do not give any credence to anything else. And I pull back from that a little bit. I have a hard time with that because, obviously I'm a behaviorist, I'm a doctoral level behavior analyst, and I'm a psychologist, but I have always known that this is not a learned disorder. And yes, we're changing behavior, but it's a human being. And this human being has medical needs, dietary needs, sleep-related issues, immune-related issues, pain, gastrointestinal issues. And so for me, those providers of ABA who are open-minded about what else is out there, and they're open-minded about learning and saying, okay, so, this child has a lot of dietary issues. I'm going to respect the diet that the child is on. I am going to make sure that we don't mess up this diet. I'm going to make sure the child is also able to receive his occupational therapy because he has sensory needs. I'm going to make sure that I communicate with the physicians involved because this child has seizure disorder or whatever it might be. I think ABA providers who have a multidisciplinary approach are, in my mind, going to be more successful because they just, they take care of the whole organism, the whole person, rather than looking at it as just a black box with behaviors. So to me, those are some of the more important things. Shannon, what are your thoughts?
I think there's so many things, right? But I think one of the things that you have to ask out the gate is how much availability do you have for therapists? If I prioritize ABA and say that I'm going to get my child to be with your therapists for the number of hours that the prescription is written, can you fill that prescription? Or are you only able to do half of it? I think you need to know going in. And I'll tell you what else, why I think that that's a good question to ask, because I think you need to set the tone with your ABA provider and let them know you're taking it seriously.
Yeah.
Because that would be my first question. And then my second question would be, as much as we're going to prioritize ABA, we want to know that you're working in a multidisciplinary way. But I think my fear is that if you start with the multidisciplinary question, that they'll be afraid, because we see a lot of families, I'm sure Dr. Granpeesheh, that they're like, well, we'll do ABA, but we'd like to do 8 hours of ABA, and we're going to do 10 hours of equine therapy, and we're going to do speech and OT, but we only have time for 10 hours of ABA. Yeah. Whereas, I mean, if I could give you anything, I would say to you, depending on, let's say your child has a prescription for 30 hours of ABA, I would tell you to go do the 30 hours of ABA and then go do the 10 hours of equine therapy. Make sure that you do the speech and the OT, and you do all of them.
Yep.
And you'll be on a treadmill, but in a couple of years, you'll be like, whoo, wasn't that amazing? Look where we are now.
Oh, yeah.
But I think a lot of ABA providers have gotten used to parents who are not committed. So I would lay that groundwork first and tell them, you're committed. Are they going to take it as seriously as you are? Because I think that sets a tone.
Yeah.
But then I don't know how to ask this question, Dr. Granpeesheh, but one of the things that I walked away with a couple of weeks ago, if you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.